Hey guys, Dr. Justin Marcagiani here. Real quick, we're going to be going over a lab test. Have you ever seen H. pylori before? We're going to dive into a lab that has very high levels of H. pylori and some other microbes. So we're going to dive in and kind of show you what this looks like in action. Again, Dr. J here. If you want more information, click on the subscribe button. Make sure you put the comments down below. Love to see what you have to say and be answering your comments too. All right, cool. Real quick here. So here's a stool test here. I run these tests with patients all the time from patients all over the world. So they're quite accessible. We mail them out to patients and they're able to complete them in the comfort of their own home. So this is page one here that looks at a lot of different bacterial pathogens. Pretty clean, not too bad. So we'll see things like Campylobacter, C. diff, E. coli, Shigella-like toxin, Salmonella, a lot of E. coli-like toxins. Pretty good with this test here out of the gates. Even some viral pathogens too. Not too bad. Now on page two, this is where we see a lot of H. pylori present. So just so you know, this is 8,170 cells, okay? So anything greater than 1,000. So we move the decimal place because it's e to the 3. 1, that's 81.7. 2 is 817. 3 is 8,170. So that's a lot of cells of H. pylori using PCR testing. And the threshold is 1,000. So this person's over 8 times above the levels for H. pylori. Now, this person had a lot of gastritis and gut inflammation, so this actually made quite sense. And this person already has a lot of relief already without even going after the H. pylori directly, because we do so many things that get to the root: improve digestive function, enzyme, acid, bile function, getting out the inflammatory foods, really working on optimal digestion. So this is important. So a lot of H. pylori, no major virulence factors, which could tell us, potential genetic predisposition for how strong this bug could be. Now in the commensal bacteria, this is normal bacteria. Now we see the lactobacillus and the bifido. These are two probiotics here and here. Actually look pretty decent, not too bad. Now the Akkermansia is a mucinophilic bacteria that helps produce mucus on that gut lining, very protective, very anti-inflammatory, and does help with inflammation and gut permeability. And so we definitely have to work on that when it is appropriate with this patient's care plan. And then we'll see the bacteroides, the big phyla of bacteria, the firmicutes and bacteroides are very high. So as we knock down some of the H. pylori, that will kind of be taken down as we knock down some of the bigger bugs here. Now in the dysbiotic bacteria section, this is the bad bacteria section. We have some staph, it's a little bit elevated, just a little above the reference range. We have some strep, a little above the reference range, not too bad. And then methanobacteria, about 2x the reference range, not so bad. Here it's about 17 almost. So that's pretty high. So strep's getting a little bit high there. Methanobacteria is only about 2. And then we come over here to Prevotella, just a little bit. So this person doesn't have a ton of other dysbiotic bacteria really outside of the strep there. And then we come down to the parasite section, and worms looking pretty good, not too bad here at all. And then steatocrit levels look good. That's a malabsorbed fat, how much fat we have in the stool. And then enzyme levels look decent as well. We want to be above 400. This is a sign of good enzymatic production. Again, we could still have low levels. We may have to add in hydrochloric acid because hydrochloric acid does help make elastase and stimulate elastase production, I should say. And we do know H. pylori does produce ammonia, which has a pH of 11, which is very alkaline. So if your stomach should be around 2, 2.5, that could gently raise that pH up and decrease the acidity, which could decrease internal enzyme production. So even though this person is doing pretty good, they could be even doing better. It's possible, right? And then we have beta-glucuronidase, which is an enzyme marker for bad bacteria, looking pretty decent. Occult blood is high, and so this person does have potential gastritis or at least some GERD issues, and so there could be some subclinical ulcer happening here. Again, their patient's symptoms are improving. There's no overt blood in the stool, and there's no significant gut inflammation. There's a little bit. Calprotectin is a protein produced by the intestines when it's above 50. That's considered mild. Conventional medicine says 173. Once you start hitting above 50, that's a little concerning. EPX is another protein that's produced by the intestines, and that's by the immune system, I should say. This is like the equivalent of C-reactive protein in your blood, right? C-reactive protein is an inflammatory protein. This is the kind of the equivalent for your intestinal tract. Gluten antibodies looks good, but again, you could still have an immune response to gluten and not make gluten antibodies. You could still be having inflammation due to it without having an immune reaction. Plus, if you cut it out for a period of time, you could have lower gluten and give you a false negative. So keep an eye on that. IgA levels are up a little bit. They're still kind of at the top of the green, but there could be some immune stress going on. That's why the IgA levels are high. And of course, the occult blood. I think this person also has a little bit of hemorrhoids, and there's some GERD going on there. So we always say, hey, can you see blood in your stool? Is there a history of hemorrhoids? That could also give you elevations. So we always careful. We always run like maybe a CBC to look at hemoglobin, hematocrit, and RBCs, red blood cells, and even keep an eye on ferritin to make sure it's not dropping below where it's a significant concern. We can always rule that out as well. All right, guys, just want to give you a little insight under the hood and what it's like to work with a functional provider like myself and what we do. We kind of dive in deep, and we're making diet changes, lifestyle changes. We're making supplement recommendations. We're trying to reestablish healthy physiology. We're looking at all the body systems, the gut, the brain, neurotransmitters, hormones, detoxification, and we're trying to put it all together. Conventional medicine just focuses on one thing, and it just treats the symptoms of that area, right? Oh, acid reflux, oh, PPI, that's it. We're not working on improving function. We're not looking at how the systems connect. And so as a functional medicine doctor, we're trying to connect the body systems and make sure we get to the root cause of why your body's functioning is not at the highest level possible. So again, Dr. J here. If you enjoyed today's video, let me know. Comments down below. Make sure you subscribe. Helps the search algorithm. And again, love to see recommendations, more topics. And if you want to dive in deeper, I see patients all over the world via functional medicine. There'll be a link down below if you want to reach out and get more support. All right, guys. Nice chat. Take care. Bye.